Ghana, like many sub-Saharan countries of Africa, has twice the number of children per adult as countries in the developed world. And yet only one comprehensive children's hospital exists in the whole of the continent, over 4,000 miles away from Ghana in South Africa. Because of this lack of access to quality medical care, women and children across all of sub-Saharan Africa suffer needlessly. Where hospitals and clinics do exist, many are not fully staffed or have adequate medical equipment. One Ghanaian physician, Victor Agbebo, was acutely familiar with the needs of African mothers and children. From the vision and compassion of Victor and his wife, Dr. Catrell Agbebo, the Amani Medical Foundation was born, dedicated to establishing the first comprehensive children's hospital in West Africa.
Amani Medical Foundation was started in 2000. We came on a trip and visiting with friends and family. We heard about the deplorable conditions of women and children in the country. In the government hospitals, there are instances where 4 children have to share a bed. The Lord really blessed us on that trip and laid a burden on our hearts to provide a place for them where they could be healthy, thrive, to fulfill their God-given potential. Our goal is to build a state-of-the-art women and children's hospital that will serve the needs of not only Ghana, but also the surrounding West African countries.
As preparation for the eventual construction of the hospital, the Amani team has worked for years alongside Ghanaian physicians, building relationships and serving the communities surrounding Accra. In summer 2018, a volunteer group of U.S. physicians and medical residents traveled with the Agbebos to participate in a women's health fair. The team collaborated with senior consultant physicians and staff from a local government teaching hospital. Their work focused on early screening for the prevention of breast and cervical cancer and provided continuing medical education and training in gynecological procedures.
Your being here is very significant in financial issues. Many women that have health issues do not go to the hospitals. And most of the priority of the money that they have is to help their children go to school so that they can get an education. And so because of that, many women will rather educate their children than to use the money to care for themselves. So therefore, they end up being sick. They age very fast with basic illnesses that could have been solved, but because of the expense, they're not able to solve it, and many of them find themselves in a worse position or condition than the initial state, and they die.
So the past several years now, I've come to Ghana and done multiple surgical procedures varying from hernia surgery to several OBGYN cases and just lumps and bumps as well. And I've been overwhelmed to see how many patients have come with hernias as well as other surgical issues that they've had for many years, but just lived with it because of their lack of access to surgical care.
May God bless you that you've come here today by grace and you've helped them. You've come to help us, to remove us from our trials, and you've taken us to a different level. God bless you. This shouldn't be the last time you've come. It should continue because we have a big problem in Ghana.
The acquisition of this land in Ghana is evidence of the grace of God and what He's doing through us right now and through many others who are partnering with us right here in Ghana.
And we are looking forward to the establishment of this facility. Thank you.